Let us now focus our discussion on the characteristics and features of community and public health nursing, or CPHN. By exploring the different characteristics and features, we will learn to appreciate this field of nursing practice. One key characteristic of CPHN is that it is developmental. This means that our approach is future oriented and empowering. The people in the community are primarily responsible for their health. In community health nursing, we believe that health begins with the people. Our role is to guide and empower them, but they are the main agents of their health. We encourage self reliance rather than dependency. We promote self care and functional independence. Our main task is health education. We teach people how to care for themselves and maintain wellness, not just to treat disease. In CPHN, health education is a primary activity. And like in the hospital, where we might be focused on procedures or medications and treatments, in CPHN, education is front and center. It is through knowledge that people gain control over their health. That is why we spend so much time teaching in the community. The next one is that CPHN is multidisciplinary, meaning health is not just our responsibility alone, it is everyone else's. As community health nurses, we foster collaboration with different professionals and sectors within our society. We work alongside physicians, social workers, teachers, barangay officials, and even spiritual leaders. Everyone has a role in improving health, and we help bring them together. We also work within and among government agencies or departments. Collaboration often involves coordinating with both the public and private sectors. Our job is to unify efforts so that health services are efficient, comprehensive, and accessible. Another defining characteristic is that CPHN is ecology oriented. This means we consider people's environment when planning and delivering care. Our care is provided in the natural environment or the people's community. And like in hospitals where the setting is controlled, in community health nursing, we meet people where they are, at home, in their neighborhood, or wherever they live and work. This allows us to truly see the health risks and opportunities in their actual context. Settings include homes, schools, workplaces, even prisons and churches. Yes, our workplaces in the community are diverse. We might do prenatal visits in the home, TB education in the workplace, conduct blood pressure checks in churches. The flexibility of our setting reflects our mission to bring healthcare closer to the people. CPHN is also grounded in the principle of social justice. We believe that health is a basic human right and not a privilege. All people should enjoy access to quality health care, regardless of age, gender, income, religion, or ethnicity. Everyone deserves quality health services. As nurses, we advocate for equity, especially for the marginalized sectors. We protect the interest of everyone by advocating for equitable health care. This means speaking up for the vulnerable, addressing health disparities, and making sure that policies and programs do not exclude anyone. We are not just providers of care, we are also advocates. One key strength of CPHN is that we value the involvement of the people we serve, who are the consumers of health services. People in the community are not merely consumers or end users of healthcare services. They are considered as our partners in health. We treat people in the community as collaborators, not just passive recipients. We include them in planning, decision making, and evaluation of health programs. Active participation at all levels is essential, from barangay health workers to everyone in the community. Participation is critical. Health programs are more effective and sustainable when the community takes ownership. The next point clarifies a common misconception. CPHN services are not free. They are publicly funded. Again, health services in the government hospitals or facilities are not free. They are funded by taxes of the people. The money used to deliver health programs comes from taxpayers. That means health service is a right and people are entitled to them. Healthcare is a basic social service that has to be provided to all. Like education, healthcare is a public thrust. Our job is to ensure that this service reaches everyone, especially those who need it most. We often say that prevention is better than cure, and CPHN takes this principle to heart. Our services are not limited to the health needs of the community. Our job doesn't end with providing care. We also look at risk factors, determinants of health, and promote practices that enable the people in the community to avoid disease before it starts. We aim to reduce the risks for vulnerable populations. We focus on groups that are at higher risks. Most likely, they are infants, pregnant women, the elderly, persons with disabilities, and the poor. We create targeted programs to protect them and strengthen their health outcomes. Community health nursing is comprehensive. From womb to tomb, we provide holistic care. We serve people at every stage of life, from prenatal to geriatric care. This also means addressing physical, emotional, social, and even spiritual needs. In the community, we cannot choose those who will serve, and we cannot also predict cases. And like in the hospital, we can serve whoever needs care while we are on duty. However, in the community, most likely everyone needs your nursing care. It could be whatever problem they might have: physical, mental, emotional, and what we have said a while ago could also be spiritual need. That said, CPHN requires the nurse to be skilled and knowledgeable on the broad areas of nursing. Because of this variety, we need a wide skill set, from immunizations to environmental sanitation, health teaching, family planning, and case detection. Versatility is the key. Now, let us move into the philosophical and ethical backbone of our practice. These principles guide our decisions and actions in the community. We observe the worth and dignity of man. Every individual is valuable. We honor their dignity regardless of social status, illness, or background. Responsibility for health rests primarily on people. We empower people to take control of their health. We assist, but we do not take over. We aim to achieve or attain independence and self reliance in health. Our goal is to make communities self sustaining so they won't always need outside help. We want them to know what to do and how to do it. Our job requires active participation of the people. Health programs do not work without the community's involvement. We need their voices, decisions, and hands on support. We adhere to the tenets of social justice, which means promoting good. We are called to go against inequality and make sure everyone has a fair chance at health. That said, we ensure the observance of universal ethical principles like beneficence, non maleficence, veracity, fidelity, and autonomy. These principles guide our ethical decisions daily. To wrap up, community and public health nursing is a people centered, preventive, and community based practice that empowers individuals to take responsibility for their health. It thrives on collaboration across disciplines and sectors, addressing health holistically in real life community settings. Our practice is guided by ethics and social justice as we ensure to provide equitable, dignified, and accessible care for all.